So effects of ischemia can either be permanent or reversible depending upon the duration. The cutoff that you should remember is 20 minutes. The course of a patient after an ischemic heart disease, patient can be symptomatic or patient can be asymptomatic. Sometimes they come for master health checkups. On the ECG, we'll see a Q wave, then we'll probe, they will tell that never have I ever had chest pain, never develop any symptoms of ischemic heart disease. So patient can either be symptomatic or asymptomatic, or sometimes patients are there sleeping in their house, suddenly they will tell you he was sleeping, suddenly he died, next day morning we tried waking him up, he was dead. So sudden cardiac death. Any course can happen in any patient depending upon the vulnerability factors that we discussed previously. Heart failure can occur on the long run. Suppose someone has an ischemic heart disease, their ejection fraction becomes, the part of the myocardium which is going to contract becomes less, properly contracting myocardium becomes less. So the ejection fraction is going to become 30%. On the long run, they are going to develop features of heart failure. So heart failure can be the end result of ischemic heart disease, or there are going to be electrical changes that we discussed. So rhythm disturbances can happen, arrhythmia can happen. This arrhythmia is the most common cause of sudden cardiac death in patients with ischemic heart disease. So this is the long-term prognostication of patients with ischemic heart disease, whether they remain symptomatic, asymptomatic, or go into sudden cardiac death, or whether they develop heart failure on the long run, or whether they develop arrhythmia eventually leading to sudden cardiac death. So we have until now seen most of the pathogenic mechanisms which are going to lead to ischemic heart disease. A short mention of the other pathogenic mechanisms which can cause ischemic heart disease. Spontaneous coronary artery dissection. This can lead to about 4 to 5% of coronary events, that is ischemic heart disease, can be due to coronary artery dissection, which means a break in the wall of the coronary arteries. You have the adventitia media and the intima, there can be a break in the intima. Just like we discussed in aortic dissection, the same can happen in case of coronary arteries also. This spontaneous coronary artery dissection can lead to ischemic heart disease. Embolism to the coronary artery. Suppose patient has a deep vein thrombosis. In the lower limb, patient is having a deep vein thrombosis. This is going to travel through the veins to the IVC and then to the heart. But normally what happens through the IVC, if it goes to the heart, it is going to go into the right atrium, it can go into the right ventricle. From there it has to go to the lung. And lung has minute small capillaries. Beyond that, it is not going to cross from these capillaries, come back through the pulmonary veins to the left side of the heart. This is unlikely. That is why commonly DVT does not cause symptoms of arterial thrombosis. DVT can complicate and cause pulmonary embolism. Okay. So DVT, I think all of you would be aware of, a thrombosis, a clot is getting formed in the deep veins of the leg that can get dislodged through the venous system up to the right side of the heart. It can cause an RV thrombosis. Mostly it will go up to the pulmonary capillaries and it will cause pulmonary embolism. It can't travel beyond that because the capillaries are very minute. Any clot would get stuck in the pulmonary artery itself. It will not travel beyond that. But in the rare event of a patient having a patent foramen ovale, there is a communication between the right atrium and the left atrium. So whichever thrombus, a part of it broke, that is called as an embolus. This embolic part traveled through the IVC, came to the right atrium, and from the right atrium through this patent foramen ovale it can enter into the left atrium. Once it reaches the left atrium, it can go to any part of the systemic circulation or to any other artery. So from the left atrium it will go into the left ventricle. From the left ventricle we have the aorta arising, right? So from the left ventricle this embolus travels into the aorta and you have the coronary arteries arising from the base of the aorta. This embolus can go and obstruct one coronary artery, thereby causing embolism to coronary artery that can lead to ischemic heart disease. All these are very rare instances. Atherosclerosis is the main mechanism, that is why we discussed it first. Vasospasm. Cocaine, we discussed about cocaine already. Cocaine can cause vasospasm. Vasospasm means constriction of the blood vessel. So a blood vessel which was like this, due to cocaine intake, suddenly it will become constricted. So there is a sudden luminal reduction, sudden narrowing of the lumen. Vasospasm is generally reversible. So this sudden vasospasm will cause ischemia, sudden ischemia to the part of the myocardium which it was already supplying. So that leads to ischemic heart disease. Aortitis is an inflammation of the aortic root. Aortic root is going to get inflamed. It can occur in diseases like syphilis. So in such a phenomenon, the ostium, the coronary ostium, the opening of the coronary artery can get obstructed due to this inflammation, and due to this obstruction there can be reduced blood flow through the coronaries, leading to ischemic heart disease. Vasculitis can happen. That can lead to vasculitis is an inflammation of the blood vessels. It can happen anywhere. In your medium vessel vasculitis, you can have the coronary arteries getting involved, the aorta getting involved in the large vessel vasculitis or medium vessel vasculitis, thereby leading to symptoms of ischemic heart disease.